Welcome to The Topic, where we highlight Houston Community College, our students, our programs, and our reach into the community. I'm Todd Duplantis. We're live every Tuesday afternoon, 1 p.m. Central Time on Facebook and YouTube. Find us in social media across all social media channels, including LinkedIn, YouTube. You can find us as Houston Community College District. Stay tuned because later in the show, I'll tell you how you can download audio versions of all of our shows as podcasts. When doctors need to diagnose a condition, few things substitute in directly viewing what's happening inside the body. Coleman College of Health Sciences is training endoscopy technicians to help doctors do just that. We're joined this afternoon by Dr. Phillip Nicotera, president of Coleman College, and also Dr. G.S. Raju from MD Anderson Cancer Center. Dr. Nicotera, always good to see you. And Dr. Raju, welcome to the show.
Thanks, Todd. Great to be here again.
We want to start. Let's talk about what is endoscopy first off, and why is it so important with today's medical practice?
So an endoscopic technician aids the endoscopist, who's a physician. And so I think the easiest way to describe this is, I think we're all familiar with the term colonoscopies and what that is. And so I think that's probably the most simplistic way. So the technician aids the physician in doing that procedure. So it can be a visual inspection, or it actually can run into more diagnostic and also as well as a treatment. Dr. Raju is an expert in that field, and he certainly can elaborate on what I said.
Thank you, Dr. Nicotera. Thank you, Todd. I want to thank the community college for organizing this show. When you think about endoscopy, I think it's important for us to go back about 50 years, right? In the last 50 years, endoscopy has certainly replaced surgery on many fronts. What do I mean by that? If somebody is in their high school years or early college years and they go to their grandpa and ask, what happened when you had an ulcer bleed? At that time, 50 years ago, they required surgery. Now, they don't require surgery. The bleeding can be stopped using endoscopy. That is, putting a tube down, right, and then trying to fix the issue. There are so many things that can be done using endoscopy, and now endoscopy is used for diagnosis, treatment of conditions, and also palliating different problems.
I mean, you're still going in the body, but is it because it's less invasive is the reason why? I mean, obviously, from what I think of endoscopy, I think of, for the most part, of a least invasive operation.
So what you do is, if you think about the gastrointestinal tract, it's a tube starting from one end and going to the other end. And in the past, when you wanted to go there, you had to cut open the abdomen or the chest to fix it. Now you can pass a flexible tube that goes down from this end or the other end, and able to see what is inside, able to take a tissue for diagnosis, and able to fix problems. Whether it is bleeding, you can stop the bleeding. If it is a blockage, you can unblock. If it is a stone, you could remove. If it is a polyp, you can cut it out. All these things can be done without the need for surgery or cutting it open. So that's what it is. And endoscopy has revolutionized. Right. And over 18 million procedures are done in this country every year.
And I guess that brings us around to there's a need for endoscopy technicians. Let's talk about how this program came about.
So let's ask Phil to fill in, and then I'll fill in the details.
Sure. Thank you, Dr. Raju. Well, Dr. Raju actually wrote an email to the Chancellor of Houston Community College expressing the void in the field and the need for professionally trained and academically prepared technicians. And so from that point on, Dr. Raju and I, on the behalf of Dr. Maldonado, met. We thought it was a great idea. We saw the void. There was no other program in Texas at the time, and we could only find one other program in the United States at the time. So we felt this was a true need. And so with Dr. Raju's aid and some of his colleagues, we decided to embark on putting together this program. And so I'll give up some time to Dr. Raju to fill in some of the blanks.
So if you think about a surgeon in the operating room, he needs a surgical tech to assist with the procedure. Surgeons would not allow anybody to just come into the operating room and assist unless they have gone through a 2 years of surgical tech training program. So you can go to community college and get trained. When it comes to endoscopy, until now, until a couple of years ago, when we started the program, people came into the endoscopy unit, and the senior people who are doing the job trained them, and then they developed the skills over a period of time. And that is not sustainable.
Right.
So we felt that we should come up with a program that allows them to learn all the aspects of endoscopy, so they're ready, trained, and ready to work. And that's the concept we actually developed in Coleman College with the help of many people from the Texas Medical Center, our industry partners. And it was a huge, huge, successful team effort.
Dr. Nicotera, I would imagine that the partnership like you have with MD Anderson, is that what makes our program at HCC so unique, the partnership also being in the midst of the medical center?
Yeah, that's absolutely true, Todd. So if we think about it, you know, when I look at what our responsibility is as a community college and, you know, playing a role in the workforce in healthcare, it's to respond to needs to our partners, such as MD Anderson and others in the Texas Medical Center. So when Dr. Raju wrote to us and shared with us the need for technicians, we responded, and I think that's very important for the public to know that we respond to the needs of our healthcare community to make it better and to provide the workforce. Our partnerships are vital to being able to do this, and as Dr. Raju mentioned, we had many collaborators from the Texas Medical Center, institutions within the Texas Medical Center, to spend a lot of time after hours to work on the curriculum for this program. So it was a very, very cooperative and very true partnership.
Well, gentlemen, we appreciate you joining us this afternoon. I know a lot of people are wondering, how do I get into this endoscopy tech program? We're going to put some links in our social media post where they can visit our website and take them to the information on the program. Dr. G.S. Raju, thank you for being here, sir, MD Anderson Cancer Center. And Dr. Phillip Nicotera, president of Coleman College, thank you for joining us. We'll see you again soon.
Thanks, Todd.
All right, we're going to take a short break. When we return on the topic, we'll be learning how students move through the endoscopy program. All that and more coming up in 60 seconds.
Sometimes what you need just shows up. Houston Community College has your back, whether you're knocking out some basics or upping your game for a better job. Enroll today for spring classes and frame your future with HCC.
For more than a year, we have kept you informed with more than 500 remote episodes. But now we're back, bigger and better, with more news and more guests. Join us live every weekday at 10 a.m. on Facebook and YouTube. and on HCC TV at noon and 5 p.m. You can watch from anywhere. We go where you go. Welcome back to The Topic. I'm Todd Duplantis. Good to have you with us this Tuesday afternoon. We're live every Tuesday, 1 p.m. Central Time. Look for us in social media as Houston Community College District. Follow us on Twitter. You can also find us on YouTube and subscribe to our YouTube channel and get notifications when we have brand new shows like this one. We're talking about Coleman College's Health Sciences Endoscopy Technician Program. And right now we're joined by Melissa Bruton, and Melissa is the Program Director for Surgical Technology at Coleman College. Melissa, good to see you.
Thank you. Thank you for having us. We're excited to be here.
Now, we heard about kind of launching the endoscopy program from Dr. Nicotera and Dr. Raju, and how there's a need for it out there. How common is this program in the state of Texas? I understand we were one of the first, if not the first, doing it.
And I believe we're still the only one in the state of Texas. There are some, I believe, that are coming, that are trying to start a program. So this is we had our second graduation this May. So we're very excited to have that happen. There is a definite need. I worked in endoscopy over 30 years ago as a nurse, and I filled a role that I had probably a paragraph of education in that role. In surgical technology, there is one paragraph on endoscopy. So it is a big need. As you heard from Dr. Raju, the techniques, the high-tech devices that they use now prevent having to go into a surgery and open a person up. They're able to remove those things using the scopes themselves. So it's very minimally invasive.
What I found fascinating is when Dr. Raju was talking about the fact that when they were getting new personnel into these programs or into the operating room, they were having to teach them themselves. Now HCC is answering the demand to train these technicians. So when you get a technician, you know they're trained in the way that you need them for the first day at work, right?
Yes, and we have a lot of employers at the different hospitals contacting us. They actually came to the college to recruit. And so far, from what I've understood, the first year we had 100% job placement. The
Wow.
Second year, I'm sure we'll do the same. The education that they get at HCC is top-notch education. The students, they go out into the clinical sites, they learn from preceptors, and they fulfill that role as an educated person, not a trained by somebody else on the job trained person, which makes a huge difference. Dr. Raju has spoken about the students and the program at his conferences that he has gone through. Our students also had 100% pass rate on an exam that the FASGE, which stands for American Society for Gastrointestinal Endoscopy, that they provided for our students to take to prepare them for, or to show that they have the knowledge and skills that they need to perform.
What type of, obviously it's a very high demand job market out there for endoscopy technicians. What type of earnings could a student expect? What's the median earning, and are there high ends, low ends? What can they expect once they get through? From what I understand, it's a 2-year program, right?
Correct. I've heard our students are actually getting paid more than the median. The median is around 20 per hour, and I've heard our students have been offered more than that. Yeah, so that's a pretty good one year entry into the field.
You also, I know things are a little different at Coleman College as opposed to the rest of the district, because the students for them in most cases go in as cohorts, right? Where they're starting at a certain time. So do you have to get on a waiting list to get into this program? I mean, is there popularity to it? Does it fill up? And what would be the best time for a student to register for it?
Register now. Right now it's a brand new program, so it's not well known yet. So there's opportunities for the public to apply for that program and have a relatively positive outcome on getting into the program. And that is because it's brand new. But once the knowledge of the public comes in there probably will be a waiting list. So act now.
Right.
The jobs are there. The education they get is top notch. And I think that's very important that the employers are coming to HCC. So the students do have to apply, but when you have employers coming to you, it's a little bit different than going out and applying.
And Coleman, I notice you guys also have very important job fairs that your students can get a chance to meet some of these employers, don't you?
Yes, we do. We had one recently where the different employers came through HCC Coleman campus, and it allowed the students to go downstairs and participate, grab business cards and find out more information of what's located in the medical center.
Speaking of the medical center, I mean, the fact that Coleman's in the middle of the medical center, obviously a lot of job opportunity there, but what type of offices or with these students that go through this technician program, will they work primarily in hospitals, or they work for like MD Anderson Cancer Center? Where would they necessarily work? Because I'm sure it's not always in the medical center.
Correct. Well, at MD Anderson, the first year graduates, I believe Dr. Raju, the MD Anderson hired 4 of our graduates, which is really incredible. And they would work in the endoscopy suites in the different hospitals. So at St. Luke's, MD Anderson, Memorial Hermann, Houston Methodist, all of those different hospitals have endoscopy units, and the students would work in the endoscopy suites right next to the gastroenterologist.
And once again, you've just graduated. Was it the first cohort that went through this program for the full 2 years?
The second. It's
The
1
second.
year.
Okay, it's a 1 year. Okay, second. And you do, I mean, it sounds like the jobs are abundant out there, and it sounds like these students are going to get in. They're not going to have any problem whatsoever finding work if they graduate through the program, right?
Correct.
Incredible. All right. Well, I really appreciate you joining us, Melissa. Thank you for joining us. We've been talking with Melissa Bruton. She's the program director for surgical technology at HCC's Coleman College. We look forward to seeing you again, and we'll have all the information on enrolling in the program in our post after the show. Thank you.
Thank you so much.
All right. We're going to take a short break. When we return, we'll talk to one of our students who's going through the program. Topic returns in 60 seconds.
Sometimes what you need just shows up. Houston Community College has your back, whether you're knocking out some basics or upping your game for a better job. Enroll today for spring classes and frame your future with HCC.
When I was your age, I was just like you, fascinated by stars. But now I get to search for life in the universe. And who knows, maybe life is looking for us too.
So we're like aliens to them?
Yeah. Does anyone want to be a scientist now?
I do.
Awesome. We need more girls in STEM.
Maybe we can find aliens.
Things could be stranger, but I don't know how. I'm going through changes, through all of the strangeness. I'm going through changes now.
Welcome back to The Topic. I'm Todd Duplantis, and we're live every Tuesday afternoon, 1 p.m. You can find us on Facebook and YouTube. Look for us as Houston Community College District. You can also download audio versions of all of our shows at hccs.edu/podcast. We're talking about Coleman College of Health Sciences' new endoscopy technician program. And we're joined right now by one of the students, endoscopy tech student, Julie McMahon. Julie, welcome to the show.
Thank you so much for having me. I appreciate it.
Now, let's talk about, obviously, it's a relatively new program. What attracted you to the program, and how did you find out about it?
Well, I have a background in human resources, and then I was home for many years raising my family. So when I decided that it was time to reenter the workforce, I started researching online, and I came across the HCC Health Sciences program options. And I started looking through them all. I'd always been interested in the medical field, and so I wanted to kind of dip my toe in. This program in particular grabbed my attention because of the technology. The cameras, what can be done with these cameras is just amazing. And most people, including myself, didn't have any idea. Most people don't have any idea how much these cameras can do and how life-saving they can be. So I started looking into it. I also had a personal interest. I've lost a close friend and a close friend's father to colon cancer at very young ages. So I think it's such meaningful work, and that's kind of where it all started.
How far along are you in the program? Are you in the midst of it now? Are you about to graduate? Where are you in the program?
My class, I'm in the second class, and we just graduated on May 9th. So a couple weeks ago.
And so where have you started working somewhere? Are you pursuing a job? Where do you stand with that?
I'm in the process of applying and interviewing. I had to wait just a little bit because of an out-of-town commitment with my family. So I'm in the midst of that right now, but I can tell you there's a huge need in the greater Houston area, and opportunities are constantly being sent to me and people reaching out. So that's exciting.
How do you describe what you do to your friends who are outside the medical industry? What do you describe to them that way?
It's kind of easiest to describe it to people as, surgeons, they need sort of a right-hand person to constantly be assisting them during procedures, handing them tools. We are doing, sorry, that was a balloon popping, the same thing, and helping manipulate those tools with the surgeons. So it is very much, Dr. Raju would always tell us, it's very much a team sport, endoscopy. So everyone in the room has their role, and it's really amazing to see the team work together. It's almost like a fine-tuned dance. Everybody is assisting each other and helping out and working together. And it was just super exciting to be a part of on the clinical side.
How difficult was the program to compose? Was it as difficult as you thought? Was it tougher than you would think? What was that like?
The classes were 2 nights a week from 4 to 8. So that is very livable if people want to work during the day. The clinical work in the fall was 1 day in a hospital setting. So that was a full day doing clinicals. And in the spring, it's 2 days. The classwork was doable. It was definitely not a blow off, but it is something that you can manage, if you have a family as I do, or a job on the side. The clinical work is definitely challenging. You have to be there early. You're working in a hospital setting. Your learning curve is steep, but everybody at the hospitals, everyone was incredibly supportive. Most of the doctors, they love teaching, so they're constantly showing you where they are in the body and teaching you as they're working and drilling you sometimes, which was great. The nurses, the CRNAs, everybody was incredible. And it was really great to get to meet other techs that are working out in the greater Houston area. So I did the fall at MD Anderson in the Med Center, and the spring I was at Memorial Hermann at Memorial City.
You obviously went through with a cohort. Did you keep up with your classmates as to what they were up to? Did that kind of help you getting through this program?
Yeah, we actually are still in touch. We're on a GroupMe sort of chat together, so people are touching base all the time. And even a couple of the graduates from the previous class, I ended up working with one of them who'd been hired at Memorial Hermann, and she was a really great mentor. And a couple of them have made themselves really available to us, to our class, for any questions or support that we need. So it is a great, very supportive environment. And the teachers, and Mrs. Bruton, of course, and Dr. Raju have been incredibly supportive.
Do you see yourself going back to maybe mentor in the future at HCC?
I would enjoy that. I think it's such a great, meaningful type of work. And the program being new, it's exciting. I thought it was fantastic. I can only see it getting better from here. There's been a lot of time and passion poured into it. So I'm excited that I got to be a part of it.
What would you say was your favorite thing about Coleman College while you were there?
Well, the facility is amazing. The teachers were great. I do love, as they mentioned earlier, the ability for Coleman College to place their students out in the actual field. I mean, there's no replacement for hands-on learning, and we got to take what we learned in class and actually see it live and apply it live with real patients out in the medical world in Houston. And the things that you were exposed to and got to learn about and work on with these doctors, it was incredible. It was really fantastic.
There are, a number of people who are in your position that either, because of COVID and the pandemic may have had their hours cut, their jobs lost, or maybe they're looking to make a career later in life, a new career path. What would you give them as an encouragement? Because it looks like you were able to switch gears going from HR into the medical field.
I would encourage anyone who has interest in the medical field, maybe no background, but the interest is there, to absolutely jump in and try it. The great thing about this program is because you do get so much time in a hospital setting, you will know if it's a fit for you. I mean, you'll be able to determine that rather quickly. And anyone who's in the medical field but wanting a change, I think it's and I've met people that actually had done that. There were people that were LVNs and they moved into a tech position and other things too. And I think it's a great opportunity to sort of mix up your skills, add to your skill base, and make yourself even more marketable by, working in a different area.
Julie McMahon, congratulations on getting through the program. Endoscopy technician student, soon to be an employed endoscopy tech, right?
Yes. Definitely.
All right. Thank you for being here this afternoon on the topic. And thanks to all of you for joining us. If you want information on this program, we're going to have some information, some links in our social media post after the show. We'll see you next Tuesday live, 1 p.m. for the topic. Have a good week. Afternoon, 1 p.m. Central Time on Facebook and